Hello viewers, you're welcome to our enlightenment program that seeks to enlighten you on issues that relate to your brain and spine health. My name is Dr. Ubong Ekpene, the consultant neurosurgeon at the University of Uyo Teaching Hospital in Uyo, Akwa Ibom State, Nigeria, and a lecturer with the University of Uyo. In our previous videos, we had considered a very important topic, headache. And we said headache could be primary headache if there is no clear underlying causes, or it could be secondary headache. And we said secondary headache usually has clear underlying causes. And over several videos, we considered one of the secondary causes or causes of secondary headache, and that is brain tumor. We looked at several of them. Today, we are looking at another very important cause of secondary headache, and that is head injury. It could also be called traumatic brain injury. And this has to do with injury to the brain that occurs as a result of an external force applied to the head. Usually this external force could be something like a stone used to strike the head, or it could be something like using a hard wood or a metal on the head. It could also occur from using a sharp object like a machete, or a bullet is shot on the head. All these are things that can result in a head injury, or just casual bumping the head or during fights can all lead to head injury. It is said that over 69 million people are affected on a yearly basis by head injury. And those who are age group between 16 years and 30 years, head injury tend to be the commonest cause of morbidity and mortality, and that is disability and death. And that means that this is a very important public health condition. It is called a silent pandemic because it happens around us, and yet it is not given the attention that is much needed. In fact, those who have head injury are 3 times more likely to die young compared to those who don't. And in road traffic accidents that result in death, between 70 and 80% of them are caused by head injury. And so it's very important that we understand this condition called head injury. So what are the risk factors that are involved or can result in head injury? Number 1 is males. Males tend to be more predisposed to developing head injury, particularly those aged between 15 years and 24, 25 years of age. This is the active age group. They are more risk takers, they are more daring, and they are involved in activities that predispose them to developing this condition called head injury. So apart from gender and age, motor vehicular accidents or road traffic accidents is the commonest cause of head injury worldwide, particularly in countries that are regarded as middle income and low income countries, of which Nigeria belongs. And these causes of head injury from motor vehicular accidents are from preventable situations. For instance, overspeeding, not driving within prescribed speed limits, being distracted while driving, like texting, receiving or making phone calls, or engaging in conversations that can be distracting, taking alcohol before driving, and also not using seatbelts. For those who are motorcyclists or ride bicycle, not wearing a crash helmet also increases your risk of not just having an accident, but the tendency is that it increases the impact to your brain in case of a road crash. And so it's very important that you wear a crash helmet. We'll talk about that in a few minutes. Now, what are the other causes of head injury? Falls. In some places, this is the commonest, particularly in the elderly, but this is the second commonest cause of head injury in our setting. And this could be ground level falls that could occur at home if somebody walks on slippery floors, or in the bathroom, particularly amongst the elderly. For the younger people, those who climb trees like the palm fruit harvesters or the palm wine tappers, or builders who engaged in building by climbing scaffolds, these are all at risk of falling and developing head injury and sustaining head injury. So what are the other causes? Assaults. This assault could range from domestic violence like wife battery, children maltreatment, and even husband battery, and domestic violence generally can cause head injury, could result in head injury. Or it could be more serious violent clashes that can occur in insurgencies or in communal clashes that can result in that, especially in war-torn areas. It could also result from contact sporting activities like boxing, wrestling, MMA, rugby, that's American football, or hockey. These are all sporting activities that can increase the risk of one developing head injury. And also suicide attempts. These are all risky behaviors that can predispose to developing head injury. So what are the complications of head injury? Somebody who has had head injury can develop what is called seizure disorders. And this can lead to a condition called epilepsy. Epilepsy is a condition in which a patient can have a part of the body shaking uncontrollably or the entire body. Some may be associated with clenching the teeth, biting the tongue, drooling saliva from the mouth, rolling the eyes, falling down. Sometimes they may sustain further injury during the course of these attacks. Patients could also have problems learning disabilities, cognitive decline. Could also lead to depression and other major psychiatric manifestations, personality changes. Patients can also develop what is called post-traumatic stress disorder. Depending on the part of the brain that is affected, sometimes if there's irreversible damage to the brain, it can result in a stroke-like manifestation, weakness of one side of the body. Patients may have problems with speech, may have problems with vision, many complications, and of course, headache, persistent, unrelenting headache. And that is why this condition must not be taken trivially. Those who are boxers and contact sportsmen and women may develop what is called chronic traumatic encephalopathy, which can be life-changing in a negative sense. It could also result in death. Not to mention socioeconomic problems. If a breadwinner is involved with head or with a road traffic accident and sustains head injury, especially severe head injury, and is no more able to meet up with the socioeconomic burden of taking care of the family, that can be a serious problem in the society. So head injury is not a trivial issue to be treated with kid glove. And that is why prevention is key. And prevention, they say, is always better than cure. Prevention begins with you. I said you. You are the one to prevent yourself from developing head injury. And what can you do? We said that motor vehicular accidents is the commonest cause. And some of the causes are from situations that you have control over. Why do you overspeed when you can stay within speed limit? Why do you drink alcohol and then you now go behind the wheel to drive? If you must drive, please don't drink alcohol. It can influence your ability to reason and to react when necessary. So if you must drive, don't drink alcohol. If you drink alcohol, please don't drive. Do not text while driving or receive or make calls while driving. These are distractions that could cause road traffic accidents. Do not drive without wearing your seatbelt at all times. And if you are a motorcyclist or a bicycle user on the road, use your crash helmet. It can reduce the impact of the damage to your brain in case of a road crash. And because human beings can be difficult, government has a role to play to enforce regulations on strict adherence to road rules and regulations. And defaulters, for the sake of the other road users, should be punished as necessary so that it can act as a deterrent and prevent and reduce the risk of this silent pandemic that we are talking about. Remember, prevention is key. And on the government side also, there should be provision for emergency medical services. In case there's an accident, there should be an ambulance that is well equipped to convey these people quickly to a place where they can be treated, a hospital that is well equipped as well. Emergency medicine, emergency treatment. Emergency treatment can be life-saving, even in the face of head injury. And so if you're in Akwa Ibom State, there is Akwa Ibom State Emergency Medical Service, an ambulance system with the number displayed on the screen that you can call in case there is an emergency of any sort that is medically related, including head injury, road traffic accident, where you can call these numbers so that you can get help quickly to be evacuated to where you can receive appropriate treatment. Please share this video. It can save someone's life. You can like the video. You can also click on the notification button so that you can receive notification when new videos pop up. You can follow us also on Facebook, on Instagram, on TikTok, and on YouTube for more videos. Thank you, and please ensure that you prevent head injury, for prevention is definitely cheaper, safer, and better than cure. Thank you, and God bless.